Hello, my name is GuoJian Huang. I come from Canada, Winnipeg, Manitoba. Today, my topic is advantages of mini-zinc acupuncture for treating chronic intractable pain. So when we work in the clinic, most of the time that we're fine to deal with lots of patients with kind of chronic pain. But at some moment, some patient will give you some difficult time. When I just start to practice my clinic, I met few patients that told me, hey, doctor, I do have the pain exactly, for example, on my chest. And also it can, that the touch it, it is a kind of nodule or scar tissues there. It is very painful. Can you help me? Of course, when we start to our acupuncture practice, we always believe that we are kind of expert of the pain treatment. So of course, if you're confident, yes, let me try some treatment. But I say most of the time, we just feel disappointed because the pain is still there. And also patients is also disappointed too, because they pay too money. And also that they spend maybe 30 minutes, try acupuncture needles, try cupping, try electricity, try massage. But none of the work. After finished treatment, patients say, oh, my pain is still there. What can I do? Maybe you have to ask patients to come back next time. And the same thing, that they did the same treatment and the same, the result and same disappointment. So that is kind of thing, embracing, that at the clinic. And also sometimes patients will tell you, hey, doctor, your first few session treatment, I feel much better. But right now that after these 3 sessions, I feel nothing getting better, no more improvement. It seems that in the plateau. So what can you do? Yes, what can you do? Because sometimes you can't do nothing because exactly because the scar tissue is there and also it has nodules there. You can palpate it, you can tell, that's the problems. But since you don't have any solution for this kind of problems, okay? And also that, yeah, even sometimes when we, learn from our school, from our teachers, when we do acupuncture, we need to get some sensations, the qi, like swollen, like tingles, numbness, and heaviness, all the sensations the patient feel, even that, screaming from this kind of manipulation techniques, but the pain is still the same as before treatment. So those things very, very embracing, for our acupuncture therapist. And so you feel you are useless and helpless because patient pay your money, pay your time. You spend your time with patient. You work very hard. You use all your knowledges and techniques, but nothing worked. So that's the problem. That's why is that today my topic is that how can we to deal with those kind of scar adhesion tissue cause the pain. Okay, so here, just like that, my topic, we talk about that how to treat intractable pain. Intractable pain means that it is kind of chronic, but it is very hard, to deal with this kind of pain. So sometimes this condition we call IP. The doctor can tell you, okay, this kind of pain, we only can, that take some kind of pain killers and then to manage those kind of pain. So you have to take those kind of painkiller your rest of life. Okay, so that's this kind of things, we need to improve our techniques and knowledge in our acupuncture clinic and then to resolve this problem. So to my understanding, most of the times that our intractable pain caused by these 2 reasons. One is called scar adhesion tissues. One is called myofascial trigger points. Okay, so let me talk about that. Scar adhesion tissues, and we know that when that our body soft tissue get injured, the whole process, that will get inflamed, it get swollen, get painful, and then the consequence of that the healing process is to form the scar tissue. If that the injury is very limited and the scare is small, so that when scar tissue formed, should not disturb any kind of function of your body. But in case that the injury is very big areas, very serious, and then it may cause that the widespread scar tissues inside the bodies, and then it will cause more troubles. So how many kind of scar tissues could be happen, or scar adhesion tissues inside the body when it get injured? Here I have the list. I don't have to talk all of them, but you can tell from a bone to that the ligament to tendons to muscles to fascia to blood vessel to nerves. All those kinds of tissues could be adhesive, from scar tissues. Okay, but when the scar adhesion tissue formed, what kind of risk, could be to our human body? Here we have, say, when scar tissue, formed, it has the issues increase the risk of re-injury and also decrease the range of motion. So from here, the scar tissue forms to here injured tissue, leaving the muscle weaker and less flexible. That's kind of when that the that problem from scar adhesion tissue from the muscles. And here that are just to present, that when scar tissue happens and how does it affect our muscle itself. Okay, so I have the balloon here just to represent that the normal muscle tissues, and I have the tab here represent the scar adhesion tissue. Okay, so normal, it's the muscles, the surface, the shape should be very smoothly, it looks very regular. But when scar tissue is formed across the muscle fibers, and then the shape of the muscle will be changed, and then that function, that when pressure here is much higher than top part, it doesn't like the normal the tissue, that the fear event, even of that of the pressure of the shape, very smoothly. So this kind of things, the shape changed, the function changed, and then that that the problem will show up. And also that here we talk about that myofascial adhesion and fibrosis, scar tissues, when that happen to the body, and patient will always complain, say that I just don't feel right, and the patients always feel kind of the pulling, tightness, burning sensations, catching, that within that affected areas. Okay, and also that adhesions anywhere in the muscle, tendon, ligament can result in imbalance, degeneration, and pain. And also this, because of the defect adhesions come on the surrounding muscles and nerves, and can cause more troubles. So adhesions will cause muscle to catch between each other muscles, and also can cause weakness in the muscles by shortening it, and also can cause repeated injury. That is why causes chronic intractable pain, because repeated injuries, repeated inflamed, repeated scar tissue formed, and then cause repeated pain and pain and pain and so on. Here's the summary of the adhesion cause tissue and organs stick together. And if the muscle adhesions and then reduce strength by reducing the amount of functional the muscle fibers, and limits mobility by reducing muscle length, requires more force to function within a normal range. Here also that cause that shows that that the soft tissue secondary injury from scar adhesion, the formation, it will cause the cumulative injury cycles. So that is the cause of the intractable pain. And from here, I also want to add a few more issues, from the scar adhesion tissues. Okay, not just from muscle itself, and also because from scar adhesion tissues, it can compress the nerve fibers and can cause patients and tingles, numbness, and burning sensations. Okay, if the scar adhesion tissues on the blood vessel, it will cause cold hand, cold feet, or part of the body is kind of cold. When you touch the part of the patient, you can tell the temperature in these local areas is lower than the normal that tissue, normal skin, for example, and then that it will cause that the patients feel kind of very stiff, very painful. Okay, and next when we talk about the myofascial trigger points, that is very popular, the hot topic in the last 40, 50 years from the physiotherapist, chiropractor, or massage therapist, because lots of research indicated that in our body with aging process, we have developed lots of the 5 myofascial trigger points, which is a very hyper irritable spot inside the body. So this is kind of trigger points. It's kind of that the taut band. Usually in the muscles, the trigger points supposed to be on the taut band of the muscle. What's a taut band? Taut band is that the muscle fibers shorten and then they form the tight band. That's what we call taut band. So that's why that when we talk about the trigger points on taut band, we should understand that is just part of the part of the muscle, not the whole muscle, the fibers, the bounder. Okay, so if, for example, if it says some trigger points on the biceps, doesn't mean that whole bicep muscles has been affected. Just only a few the muscle fibers on the biceps have some taut band. It has some kind of trigger points. That's the part of the muscle. Okay, the trigger points, the contracted muscle fibers decrease blood supply, causing nerve irritation and pain. That's another the cause, that chronic intractable pain. And yeah. So, and for myofascial trigger points, usually we have that 2 trigger points. We talk about most of the time we talk about the trigger points. One is active trigger points, one is latent trigger points. Active trigger point, it means it is very tender, but also that after you're pressing, after 5 or 10 seconds later, it will create one kind of readable the pain, refer pain to the certain part of your body. That's what we call active trigger points. The latent trigger points only have the tender, that when press it patient feel painful, but it doesn't have the refer pain. Okay, and of course, right now that we doctors, scientists, that mention us, it has more that trigger points, maybe not just in the muscle. It could happen in that our tendon, ligament, and so that even that our fascia, in our skin. So that's all kind of trigger points. That's why I believe that trigger point, it is kind of that aging process, that the problems. Even that right now that some research indicated that the trigger points could be found in the kids only 3 years old, some kind of trigger point, that you can figure out. And with aging process, when getting older and older and more trigger points in our body. That's why that when we're getting 40, 50, 60 years older or 70 years old, and then we get more and more pain on our body because we get more and more trigger points in our body. Okay, so here are the characteristics of the active trigger points. That we have few things here that is very painful and tender and swelling the nodules, high tension at the moment at the local location, and it has a very low pH and high acidity, and it has high concentration of the inflammatory pain substances, and also that it has very poor the blood supply inside of the trigger points. Here that just show us, what kind of chemicals, that in our active trigger points and latent trigger points, what differences. From here we can tell all kind of, that the chemicals of the pain, like TNF, LL6, subs-P, and yeah, all kind of much higher than latent trigger points. And the pH is much lower than the latent, the trigger points. Here just show that when the trigger point happened, and then what changes in our local and soft tissue, skin texture, for example, getting harder, getting colder, and also get more that, that painful, and also the color get more pale. All things could happen in the local areas. And actually, to my understanding from my experiences in my clinic, I figured out, that trigger point, just like, the cortisol in the lips, it is kind of semi-mature scar tissues. So it has that kind of scar, it is kind of scar tissue, but it's not much matured. And also it has inflammation inside of the scar tissue. So that's why it causes the pain. If the scar tissue is matured, it's supposed to know any blood vessels and nerves inside of scar tissue, except when scar adhesive tissue formed, and then that can cause more troubles. And actually, that from this treatment, most of the time, from physio, from massage therapists, they always get patients, that some massage, we call deep stroke massage, want to squeeze, those kind of trigger points and then to remove it. But of course, it is very hard to do that. Here I have the chart just to represent, that relationships between the trigger points and the scar adhesion tissues, and through that the 3D meridian, systems, and then the network, and then it can transfer the tension and the pain from local to distal areas. Okay, and then of course patients not just have the pain, and also may have the tingles, numbness inside the bodies. So that's the that the relationship between the scar adhesion tissue and also trigger points and taut band. So in my clinic, I found the most effective way to break up those kind of scar adhesion tissue and trigger point, that the most effective weapon is use the mini Zen acupuncture needle with a sharp blade on top of the needle. So here is kind of my needle I used in the clinic. It has the sharp blade on top of the needle. It's flat needle and it has blade on top. It can directly to break up the scar adhesion, the tissues, and also break up the trigger points and release the tension, release that adhesion, and then that the release and that the muscle and the soft tissues get freedom. Here that I have small video to just explain that how that scar adhesion tissue, affect the muscles between each other. Today I would like to present how to use present normal muscles. This wraps represent the skin and normal soft tissues. In normal physiological conditions, they should move very smoothly up and down, back and forth. But in case this muscle got injured, and then scar tissue formed, this muscle movement will be interrupted. For example, we have a string here, just represent the scar tissues between, because there are no any elastic fibers between, so it's hard to move them. And then how to break up the scar tissues, because in our acupuncture clinic, most of the time we only use this regular acupuncture needles. Of course, we can try to break up, but most of the time we can go through, but it can't to break up. But if you use mini Zen acupuncture needle, and then it is very easy to break up, because it has that very sharp blade on top of the needles. We can directly to cut it.
Yeah, and then the scar tissue will break up directly, and then the muscle movement will back to normal. So that's the differences from mini zinc acupuncture needle and the regular acupuncture needle.
Okay, so here we quickly talk about the features of the mini zinc acupuncture needles. Okay, first of all, this is developed from the regular acupuncture needle and the knife needle we call acupotomy. And this needles, the blade is very tiny, and the width of the blade is only 0.3 to 0.5 millimeter. The length of needle is only about 25 millimeter, and insertion depth of the needle is usually less than 0.5 centimeter. And treatment target is very superficial, never touch the deep nerve trunks of blood vessels, so it is very safe and effective. And also, of course, the treatment duration varies from a few seconds to several minutes. So that's why in my clinic, when I perform this kind of treatment, most of patients, we finish treatment by around 3 to 5 minutes. And also it can help to provide immediate pain relief result, and also can help to achieve long-term pain relief. So after treatment, most patients are getting better right away. They can tell you right away, and also it helps to achieve the long-term benefit. And also it has the dual functions and advantages of acupuncture needle stimulation and acupuncture blade catching. So that's why the needles inside the bodies, patients also can feel that the tingles, numbs, or heaviness, soreness of acupuncture sensations. And also it can directly to hear the sounds of crunching sounds, catching sounds. That means that can directly break up those kind of skin, scar adhesive tissues. So treatment is very simple, easy, effective, inexpensive, and repeatable result. So it should be very good for the acupuncturist to learn and to practice it. And also the benefit of the mini zinc acupuncture, that here I list a few benefits. First of all is directly break up the scar adhesion tissues, which lock the muscle and joints, compress blood vessels and nerves. And also mini zinc acupuncture needles can directly break up the taut band and trigger points, drains out the biochemical pain substances from the swollen hyper-irritable spots, removes the compressions on blood vessels and irritable nerve fibers, improve blood flow to promote the healing process. And also it can promote blood circulation, supplies more the nutrients and oxygen into the injured muscles and tendons to help healing and recovery. And also the chronic intractable pain will be cured, joint range of motion will be restored. So normal life will be achieved. So that one's pain-free, and then that you can enjoy your life.
Okay, so that how do you feel generally after
So
treatment?
here is the benefit feedback
I
from
feel
the patient.
great. A lot of the pain I was struggling with, it seemed to almost completely disappear. It was interesting because I could feel, the quick pokes, and then when you were touching it and it was sore, just like that, it's completely gone. It feels like almost 100%. It's great.
So here that I just want to show how do I perform this treatment. So this is migraine headache patient I treated with my mini zinc acupuncture treatment.
So you say that your migraine, how long has been that migraine, that on and off?
14, 15 years.
14, 15 years.
So it has 14, 15 years of the migraine headache history.
Yes.
Yeah, okay.
Yeah.
Yes, all 10 years, right?
Yes.
So first of all, I use hands to, that compare both sides of the tension of the muscles to see which side is higher, and then directly find those kind of, nodules and the tender nodules, and perform the needles to break up those kind of nodules. And after, few minutes treatment, so the treatment is very superficial and no bleeding.
And I give you 2 different kind of herbs for
The
you.
patients, that it feels very happy, and then after treatment, everything is done. Okay, so today that is my the presentation. Thanks for your watching. And if you have any questions, you're welcome to contact me. And have a great day. Bye-bye.